The 5-layered shield, a journey through the scalp. Slide 1. Welcome to the top of the world. Welcome, young medicos, to the first-year anatomy expedition. I am Dr. Chitra, and today we are scaling the heights of the human body, the scalp. Standing with me is Vihan, a student eager to learn the secrets of the Scalp acronym. This isn't just skin, it's a 5-layered fortress protecting the brain. We extend from the supraorbital ridges in the front to the external occipital protuberance in the back. Let's peel back the mystery, layer by layer, in our anatomy comic cast. Slide 2. S is for skin, the hair-bearing frontier. The first layer is the skin. It looks just like any other skin, Dr. Chitra, Vihan notes, pointing at the hologram. But I show him the microscopic view. The scalp's skin is thick and unique. It is the densest forest of hair follicles on the body and is packed with sebaceous glands. This makes it a prime site for sebaceous cysts. It is the outer shield, the first line of defense against the elements, and it's tightly bound to the next layer below. Slide 3. C is for connective tissue, the vascular vault. Now we go deeper into the dense connective tissue. This layer is a honeycomb of fibrous septa. Look at the blood vessels, Dr. Chitra exclaims. These vessels are held wide open by the tough fibers. This is a clinical caution zone. If you cut the scalp here, the vessels cannot retract or constrict. The result? Profuse, spurting bleeding that requires firm pressure against the bone to stop. It's the most vascular layer of the bunch. Slide 4. A is for aponeurosis, the helmet of muscle. Layer 3 is the epicranial aponeurosis, or the Galea aponeurotica. It's like a helmet, Vihan observes. This is a thin but incredibly strong sheet of tendon. It connects the frontalis muscle in the forehead to the occipitalis muscle at the back. When the frontalis contracts, it pulls this galea forward, wrinkling your forehead in surprise. Because this layer is so tense, a deep wound here will gape open widely, signaling the need for sutures. Slide 5. L is for loose areolar tissue, the danger zone. This is the layer that gives the scalp its mobility. Why is it called the danger zone, Dr. Chitra? Vihan asks. I explain that this loose tissue allows the top 3 layers to slide over the skull. However, it also contains the emissary veins. These veins connect the outside of the scalp to the inside of the skull. If an infection starts here, it can travel through these veins directly into the dural venous sinuses of the brain. Safety first. Slide 6. P is for pericranium, the anchor. The final layer of the acronym is the pericranium. This is the periosteum covering the outer surface of the skull bones. Vihan notices that it's easily stripped off the bone, except at the sutures. At the sutures, it's tightly attached to the connective tissue between the bones, I explain. This is why a, quote, cephal hematoma, a collection of blood under this layer, takes the shape of an individual skull bone and never crosses the suture lines. Slide 7. The arterial fan, the 5-way flow. The scalp is a masterpiece of blood supply. 5 pairs of arteries fan out to keep it nourished. In front of the ear, we have the supratrochlear, supraorbital, and superficial temporal. Behind the ear, the posterior auricular and occipital arteries take over. They all anastomose freely, Dr. Chitra notes. This means the scalp has an incredible ability to heal, even after a significant injury, because blood can arrive from so many different directions. Slide 8. The sensory map, nerves of the summit. How do we feel a touch on the head? Vihan asks. We look at the nerve supply. Just like the arteries, the nerves are divided by the ear. In front of the auricle, the trigeminal nerve, CNV, provides sensation through branches like the zygomaticotemporal and auriculotemporal. Behind the auricle, the spinal nerves, C2 and C3, take the lead via the lesser and greater occipital nerves. It's a perfect handoff of sensory duties. Slide 9. The emissary veins, the hidden portals. These are the most critical conduits to understand. Emissary veins are valveless, meaning blood can flow in either direction. They pass through small holes in the skull, the parietal and mastoid foramina. They balance the pressure between the scalp and the dural sinuses. Dr. Chitra explains, but they are also the highway for bacteria, turning a simple scalp wound into a potential case of meningitis or sinus thrombosis if not treated properly. Slide 10. Mission accomplished. The clinical wrap-up. As the lecture ends, Vihan reviews his notes. SCALP. Skin, connective tissue, aponeurosis, loose tissue, pericranium. He understands why scalp wounds bleed, why infections are dangerous, and why the anatomy of these 5 layers is the foundation of neurosurgery and emergency care. The summit is conquered, I tell him. You are now ready to protect the shield that protects the brain.